Welcome to the ICU podcast, where we explore the vestibular experience through conversations between patients and the health professionals who care for them.
During this podcast, we invite patients to share their stories and healthcare professionals to ask questions so they are equipped to better care for and truly see the invisible challenges faced by their patients. I'm Kimberly Warner.
And I'm Cynthia Ryan, and we are your hosts on this journey of discovery. Hi, everyone, and welcome to another episode of the ICU podcast. Today, we're going to talk about pediatric vestibular disorders that affect children. Did you know even that vestibular disorders can affect children as well as adults? I think we probably don't even think about it, but it's true. There are increasing reports of vestibular deficits in children. One study even suggests that as many as 1 in 5 children in the United States have problems with dizziness or balance. Pediatric vestibular disorders result in vertigo, gaze instability, delayed motor development, and problems with reading. These symptoms are difficult for anyone to cope with, but are especially challenging for children and their families. Pediatric vestibular healthcare specialists are hard to find, and it can be difficult for a child to describe their symptoms, which results in delayed diagnosis, and that can have just devastating results. So today we're going to talk to a vestibular pediatric specialist and the mother of a young boy who bravely battled vertigo, hearing loss, and a host of other vestibular symptoms. Just an incredible story. So let's go ahead and get into it.
So Andi Gilkey, welcome. She is our first guest here. I want to say patient guest, but it's her son that is the patient guest today. So thank you, Andi, for being here and representing your son. Andi is a licensed clinical social worker and the proud mom of a vestibular warrior. Her son is an amazing 11-year-old who loves baseball, music, video games, and his friends, of course. He has bilateral sensory neural hearing loss, unilateral enlarged vestibular aqueduct, childhood vertigo, PPPD, and vestibular migraine. So his hearing journey has been well supported by an incredible team, but his vestibular journey has been one of the biggest challenges Andi has encountered as a mother. She says it felt like an endless roller coaster full of ups and downs since he was a toddler. Through hard work and the creation of an incredible vestibular team, she is proud to say that her son has been in remission of vestibular symptoms for 10 months. That's amazing. Her ongoing goal is to share her family's story with others to provide hope and support to the vestibular community. Andi, thank you so much for being here.
Welcome. We also have Dr. Jennifer Broswell Christie, who is an associate professor in the Department of Physical Therapy at the University of Alabama at Birmingham. Her primary area of research is in the development of innovative invention methods to improve gaze stability and balance in children with vestibular-related impairments. Related to this research, Dr. Christie teaches numerous continuing education courses in the U.S. and abroad. Dr. Christie, welcome. And I have to say that whenever vestibular in children come up in any conversation, your name is there. So I'm just so excited to have you on today.
Thank you so much. And I'm excited.
I have to ask, do you two know each other already?
We do not. We just met. Yeah.
Cool.
Yes.
Well, this is going to be a really insightful conversation. I'm excited for the two of you to be able to engage with each other as well. So let's begin. Andi, maybe you can share just a little bit about your son George's earliest symptoms.
Yeah, he was a rowdy toddler, and everybody would say, wow, he's a lot. And as a therapist, I think everybody looked at him through the scope of behaviors, and I knew something wasn't right in his body. So he needed input constantly. He'd walk down a wall or walk down a hall, and he'd have to bump the hallway all the way down the hallway. If he's sitting on the couch, he's jumping on the couch. If he's sitting next to you, he's crawling all over you. He just needed input constantly. He couldn't sleep. He could not settle his body to sleep ever. And then we also had some early symptoms. We now know what they are, where he'd get up and he couldn't pick his head up in the morning. And if he did, he'd throw up all day long. And I think every doctor just kind of dismissed, we were told he was a behavioral problem. There were just lots of signs and symptoms. He didn't feel good in his body. And I knew as a therapist, it was more than just, he's a rowdy boy. Really just, he was more than that.
And you as a mother, you knew there was more going on.
Absolutely. And working with kids and my husband, I mean, we knew something was off with his sensory system. He just needed input all the time. Even when he laid in bed to go down and sleep at night, he just moved and moved and moved and wiggled, and the throwing up was very odd too as a parent. That did not seem normal, and it was dismissed by a lot of doctors. And so, yeah, we knew there was something off.
It's so fortunate that both you and your husband have some insight into behavior in children and for you, I'm sure also adults, your husband being in special education, right?
Yeah. And I always say God gave George to us, because I think a lot of things wouldn't have been missed if we wouldn't have advocated and knew it wasn't a behavioral issue. It wasn't. And I think that's how vestibular symptoms get deemed a lot, even when they come to my office saying, they can't sit in their seat. They're not reading. They're not doing what they're supposed to. And it's like, so I knew it was beyond behavioral.
Yeah, and just to comment on that, in the work that I've done with children, this is a really common story. These kids, they can't sit still, or it's because they don't have that balance mechanism to tell them where they are in space. And so they're wanting to move. They fall out of their chair, and the teachers and the people working with them think that they're doing that to be, to act out, and they get in trouble. So I've seen that a lot in my work as well.
That must be so difficult. Now, so Dr. Christie, how did you get involved in pediatric vestibular medicine?
I feel like God had a huge hand in my story as well. So I was a pediatric physical therapist, clinician for about 8 years. I graduated from LSU. I'm from Louisiana. And I decided I wanted to get more into the profession. I wanted to contribute to the literature. So I'm flipping through the Pediatric Physical Therapy Journal, and I see an ad for a research physical therapist at University of Miami to work with Dr. Rosemary Rhine, who is the person who really started this pediatric vestibular movement. And you could also get your PhD. So I applied to that program, moved all the way down to the big city, Miami, and my eyes were opened to the world of this teeny tiny little inner ear and the importance that it plays in the development of our children. And so Rose taught me everything I know about how to do research, about, we developed the dynamic visual acuity tests, and we did really probably the only randomized crossover trial that's been done where they actually measured vestibular function using gold standard methods in the participants. And we showed that, wow, the brain, as we know, is amazing. And that if you practice enough, that it will change, it will change function. And the kids do get better, and they work hard. So that's how I got into this. And after I got my PhD, I got a faculty position at University of Alabama, Birmingham, where, they have a great cochlear implant program here, some amazing clinicians. And so just continued to stay in this space and, go teach courses. And it's been amazing to be a part of. So.
How wonderful for you to have such an amazing mentor.
Oh, it was, yeah, she was wonderful. And I've had so many other mentors, people who actually mentored even Dr. Ryan, so Susan Herdman and the whole group that developed the whole vestibular rehab, the program. I get to go teach with them all over the world, and so it's been great. We're a little
You
family.
sound really passionate about it too, which I mean, I imagine the rewards are just so deep.
It's so amazing to see the outcomes. And the work that I'm doing right now, I'm working on just it's a study that's funded by the Foundation for Physical Therapy Research, where I'm looking at, if we empower the parent to do these exercises at home with the child on a daily basis, because we don't know what the dose is yet. We don't know what and I'm talking about children with vestibular hypofunction from a peripheral level, right? So those are the kids that I work with. If we empower the parent to do it at home, what's feasible for them to do in their busy, busy lives, and does that dose improve outcomes? So I think we're still at we don't know how much and exactly what's working, but so far the outcomes have been very good in the study. So
You were talking about empowering the parent, and what occurs to me is that, unlike with other, having an adult as your patient, you have essentially two patients in a way. You are treating the child and the parent in a way, educating the parents in how to support their children's vestibular recovery.
right, absolutely. We know that to change the brain, neuroplasticity requires tons of reps, and there's no way that a clinician can spend that much time one on one with the kid doing it. And so you do, like the intervention that I'm doing, I barely even touch the child. In fact, a lot of it I do on Zoom. Like I'll do my weekly progressions on Zoom, and I have the parent, okay, you're going to do the VOR training now. So they turn the head, we set a metronome, and is that, does that feel okay? And I give them feedback. And the parents they become the therapist almost. So and I try not to make it too overwhelming either. And also, as a therapist, you don't want to make a parent feel guilty about not doing it either. So it's like, okay, that's okay that you missed that session, but this is going to be a lifelong habit that you're creating, over these 8 weeks of this intervention, so that whenever you are thinking about what are we going to do today, hey, let's go to the park, and wow, there's a balance beam at the park, let's practice walking on that. So we try to get them to incorporate it into their daily lives, the intervention.
So I imagine, Andy, finding someone like Jennifer was a challenge.
Like, where were you 3 years ago?
I know. I like want to see George.
Great research project.
Yeah. What was that like for you? I mean, how in the world did you find a qualified pediatric vestibular healthcare provider? I mean, that is a mouthful, and I don't imagine there's a lot of them.
And I will say, for many parents, and I've talked to many parents along this journey of, I think the problem that we have to do a better job of is, we saw close to 20 practitioners by the time we finally got our final team in our healing process. 20. And so every doctor we would go to, whether it be ENT or neurology or a vestibular audiologist, they would say, well, you need vestibular therapy, but we were never given referrals. Anybody we ever found, I had to find on my own. So I'm a therapist and have connections in the city and know people, but I can't imagine as a parent not knowing people, not knowing anything, how you even find somebody. We don't have a vestibular center like in our city. We're a big city, but we don't have it. And so I probably called 10 or more people just asking, hey, will you see a kid with this vestibular dysfunction? No, we won't. No, we won't. And then it became interviewing. We would go for the first time when we saw one, and she said, I have no clue what to do with your child. Yeah. And then we went to the next one, and he said, I only do adults. And so it just became like this. And then we found one, but she was 2 hours away. So we couldn't drive once a week for that was too much for our family. And so I knew someone and I happened to call her. She had worked with some of the kids I'd worked with. And she happened to have, I'd say the word VOR and people go, "What's that?" I'm like, you're a physical therapist. Like, you know what this word? And so she actually had a tremendous amount of experience. She's an occupational therapist with doing that work, and she has been a part of our journey for the last 2 years.
Wow.
And my child absolutely loves her. We have lots of other people. We had a separate vision therapist who did that work. But it was very challenging. And if you're in a small community, I don't know, because even our pediatricians, nobody knew who to refer us to. They go, "We don't know anybody."
Wow.
And so for these childhood cases, like, I don't know how people find people sometimes. I can't imagine that challenge. And I think that's why people don't get the treatment they need, because there's a point, I've called 10 people that I might quit.
Mm-hmm. Yeah. And at this point, you didn't know about Vita either. Is that correct?
I think I'd had some communication, but there still was finding that right person.
Yeah.
I mean, I was on Facebook groups. I was on any kind of resource I could find, just trying to find who's going to help my child. We had every kind of symptom possible, everything possible, anything listed on a vestibular list we had.
Wow.
Yeah, and it sounds like that George actually, it sounds like he had a combination of peripheral vestibular problems and central, with that motion sensitivity, with that almost like childhood migraine kind of thing in the 3PD. So, I mean, double whammy there, to have, like, not only is his peripheral vestibular system not communicating with his brain, but then maybe the piece that is communicating with his brain is not connecting properly, so
everybody,
yeah.
me and my husband always said, if we had $1 for every doctor we saw along the way that said he's complicated, everybody would say he's complicated, but then we couldn't get, like, well, what do we do about it? They even did a surgery to repack his ear, thinking it was that somewhere along the way. So I mean, poor George, had a surgery that probably wasn't necessary because they just couldn't figure out what to do about this problem.
Yeah, and you're willing to do anything to help him. So
my funny joke was, I said, if you sold me a bag of dirt during all of this for $1 million and said it would fix him, I would have found $1 million to treat him, because I was that desperate to, like, make him better. It was horrible. I feel bad for any parent who has to go through this, because it feels so helpless, and especially when you don't have a list of resources or a vestibular imbalance center within your community.
Yeah. I mean, we hear from vestibular patients, of all ages, that it's difficult to find a provider who understands what they're going through, but it's just 10 times worse for children, because, as you said, so many healthcare providers, even a vestibular specialist, may only deal with adults.
Mm-hmm.
So, and Jennifer, I'm curious, why is that? What is different about treating a child with a vestibular disorder? How do pediatric vestibular disorders manifest in a child's life? What does it look like, and how is that different maybe for an adult?
Yeah, that's a great question. So typically an adult who gets a vestibular disorder, their brain has developed with a vestibular system, right? So they were born with a balance mechanism with these connections throughout their brain, and then they lose it. So their brain already knows what it feels like to be sort of normal, to have that mechanism, but and so the plasticity that happens is trying to, get around that, to change neurons, in the brainstem and throughout the brain. But with a child, especially if they're born with vestibular hypofunction, this kid's brain is totally different, So from birth, this kid has had to develop other mechanisms to, be able to hold their head up. So, your balance system and your postural control system involves your vision, your vestibular system, and your somatosensory system, right? So these kids have, good vision, hopefully, maybe or maybe not, and then they can feel. They have good, somatosensory system going to their parietal cortex to help them to feel, right? But what we found in the research was, you would think that they would be super users of these other two systems because they don't have a balance mechanism. But what we found was that really the three are interconnected. So if you are born without a vestibular mechanism, it affects your use of vision and somatosensory, and that those also need to be trained. That's one way. Another way is that, these kids typically, especially if you're born with hypofunction, right? So some kids are born with no vestibular function, which means, wow, they're going to really, walk late. They're going to sit late. They're going to do things late. Some kids are born with a little bit of function, right? So they have the ability to have a little bit of function. And what we're finding though as a group, that kids with hypofunction peripherally, they have developmental delays that are progressive. So if you don't get the treatment, they can walk, they can run, they can jump. So maybe, people don't go, oh yeah, they're okay. But if you really were to test them on a standardized developmental gross motor test, they would be well below 2 standard deviations below the mean. And they don't just get better on their own. They do their best, but they really do need this training. Now if parents are putting them into gymnastics and all of these things, that's going to help, their brain to develop and for them to be able to use that somatosensory and vision better. But I'll tell you what happens. I mean, a parent tries to get their kid into gymnastics that has hypofunction, but then the program doesn't let them go on because they can't walk on a balance beam. It's not their fault. So, then I'm not going to do that because I'm not successful. So long-winded answer there, but it affects the ability to use the good systems, and it causes a progressive gross motor delay. And that's just with the peripheral problem. Yeah. With the central issue and like the motion sensitivity and all of that, man, that's going to affect their ability to want to go on a playground swing, or even be able to, like I've seen kids not be able to ride in the car for very long because they get sick from the motion of the car going backwards, and that's a whole habituation kind of thing that you have to do. So the interventions are very kind of tailored. Like the exercises might look alike, just like they do for adults, but they're for a different purpose. And with kids, you do the same exercises. The exercises are based on the same theories of adaptation, substitution, and habituation, but you have to make it fun. So if the kid doesn't want to do it, they're not going to do it. They're not just going to sit and look at a card and turn their head like this. Like, you have to give them a book to read while you're turning their head, and they read the book or they identify pictures. When you're doing dynamic balance training, there has to be a goal. You got to walk here, but it's a game that you play. So those are some differences between working with kids.
Well, I imagine as these systems are developing, you also have their sense of self developing. So, and why am I not getting to advance in gymnastics, or why am I being held back, and all of that. So I'm wondering, Andy, did you observe some other kind of emotional side effects from all of this? And when you did finally learn what was going on, how did you communicate that with him?
I think it is so hard when they're little because they can't tell what's going on. And so we would just see this tantruming. I remember when he was like 4, he chased and pulled my clothes as hard as he could. And I'd be like, what is wrong with you? Like, we just thought it was typical childhood tantrums. And so by the time he was 6 and he finally, it was the best day, he said, I'm spinning. So this is George, all his doctors knows. He has the spinnies. He has the spinny scale that he uses. And so he finally could say, I'm spinning. And that could help us make sense of it. Now, George is a little bit different, that like, he pushes through everything. There's no stopping him. Even when he had the worst vertigo, he still played sports, even though it might make him sick. Like, I don't know, he's a different breed. He's just a different breed. But there was that sense of self. Once we had cochlear surgery and the vestibular functioning, and then we had hypofunction, and he got so sick, then he couldn't play sports. And he started to get left out. And his friends moved on without him. And that was really challenging and really important to instill the hope in him. We will get better. We will figure out these answers. And I think each year he's gotten older, he's able to understand it better, because we really had to get him to understand your eyes are doing all the work and you cannot rely on your eyes all the time. He had no, like if he closed his eyes, he would fall down. And so there was a lot of helping him, and his vestibular therapist did the most beautiful job of making everything fun, everything kid friendly, everything. And I think he understands better, but he's still learning. He's going to have this dysfunction, I guess I'll call it, for the rest of his life, but he's learning interceptively what's going on in my body, which is a cool gift to get at a very young age. I teach adults this all the time in my office. They have no clue what's going on in their body. He's learning, and which is a really cool gift for a kid so young.
Yeah. And I'm imagining that's empowering for him on some level too, to like finally have like visuals of what's happening and why these experiences have plagued him. And I would imagine he's maybe a little proud of knowing all of this information.
Yeah, he'll say, I'm different and I'm really proud of that. So I don't know any preteens who, I mean, he really is proud of that and everything that he's been through. It's hard, but he is.
Yeah.
I know George is 11 now, right? I want to hear from you in 10 years, because I want to know what George is doing as he enters adulthood and how this has impacted his choices. And that it kind of reminds me of another part of the question that I had for you, Jennifer, which leads to another question for you, Andy, is about the how this affects a child's learning and ability to read, for example, how it then affects their participation in school, and how then you communicate that to his teachers. Do you want to start, Jennifer?
Yeah, sure. So from kind of a scientific standpoint, the vestibulo-ocular reflex, as we know, allows your eyes to focus on a target when your head is moving at, greater than 100 degrees per second, that quick head movement that the pursuit system can't handle, right? So at very slow head movements, of course, your pursuit system can handle it, but a kid who is, looking down, looking up, they're moving their head just enough to where it would cause some slip there. So in my dissertation work with Dr. Ryan, we said, let's look at reading acuity. So this is not necessarily the understanding of what you're reading, but it's more, can you see while you're reading? Because you don't, when you're reading a book or something, you don't sit and move your head really quick, And so what we found was that there was, and this was in a very small sample size, there was a correlation between dynamic visual acuities, that's that test that we do where you look at the difference between visual acuity with your head still versus your head moving quickly like this. There was a correlation between like the kids who had really bad DVA also needed a larger print to be able to read. And so we said, this could be affecting reading from an acuity standpoint. So, wow, why don't we just give the kids bigger print? And I found in my work that doing the VOR training with them, there's some this isn't an official outcome of the study, but before the parent would say, wow, but when they were reading a book, they would need a ruler under every single line, but after doing the exercise, they can do it without having that ruler, under the line. Of course, now who reads like a paper book anymore? Everybody's on the computer scrolling and, so it's kind of a different thing. But so that has not been very well explored as far as like, does it really affect reading acuity or not? And so to me, that would be a great line of research, because that would make vestibular rehab be educationally relevant so that school systems would be obligated to provide that to these children. That would be very cool, which that's not happening right now. Then from a learning standpoint, there's a connection between the vestibular system and the vestibular nuclei and the hippocampus part of the brain, which we know is important for learning and also for learning directions. So there's been some studies with little mice where the mice with vestibular lesions can't find the cheese, they can't learn where the cheese is, and then the ones with good vestibular system, did better at finding the cheese. So I do think that there is a connection that needs to be explored further between inner ear function, reading, and learning. And
yeah. Well, I just want to interject a personal anecdote. This is something that I didn't even know I was doing this, and it must be an adaptation, but my husband pointed it out that when I read on a particularly dizzy day, I rock my head back and forth. And I don't know and like I said, it's not something I decided to do, but I think it's some way of trying to match the movement so that and it might just be a calming of the nervous system. So I'm not bracing against the movement, but I actually read better on a dizzy day if my head is going back and forth. And it's not fast. It's more metronome like, but it's interesting, the ways that our brains try to adapt to these things.
Mm-hmm.
Andy, tell us about how you dealt with George's his medical issues and explaining them to his.
I think it took us a while because what we saw is exactly what Dr. Christie is explaining, that I had a kid in kindergarten and first grader who read and learned beautifully, and all of a sudden he didn't want to read anymore. His school functioning started to go down. His grades went down, and we figured out, he had permanent nystagmus. I don't know how he read at all. And so, we had to retrain. So we had to advocate that he could have a reader. He could have larger print. That was when Dr. Christie said that was huge, because the larger print is still a piece of his recovery that he needs. So we had to go with every teacher and tell what he needs. We're very blessed that we've had people who have listened. I don't think they always fully understand, but there's a lot of modifications that he needed, especially when he was really sick, because that was one of the telltale signs we saw. He would not read. He hated reading. He still hates reading now, sadly, but he was a kid who really liked to read.
Well, and it sounds like before we started recording, it sounds like some of these teachers are willing to work with him a little bit more, and some are just, because it's invisible.
Yeah, he started a new school during, when he was at the height of being sick. And I remember one of the teachers sending a long email saying, he just seems lazy, unmotivated, like he doesn't want to do anything. And from a parent perspective, I know we're doing physical therapy every day at home, and I know how much he's working. And so unless you've had vertigo or some kind of vestibular, I just don't think they could ever put themselves in his shoes, and they can never understand. He had a cochlear. He was training that too when all of this happened. So we're trying to learn to hear through a cochlear. So we're not hearing great, and we're trying to do all this other hard work. My eyes are doing this. And so I don't think anybody ever understood how hard it was. And some would try to understand and some wouldn't. They just deemed him as kind of defiant or lazy or didn't care. And he'd even say at home, "This is so hard. Do none of you understand how hard this is for me?" I get it, buddy.
Oh.
I know.
Oh, yeah. My goodness.
Wow. How about his friends? Has he had to, does he tell his friends what he's going through, or does he kind of just pass it off?
I think some of the friends just left because he couldn't go in the neighborhood and jump on the trampoline. That was an absolute no-no. He couldn't go on the bouncy houses. He couldn't play football like all his friends. He couldn't do all of those things. So I think it's been more challenging to find the friends who can match his needs of what he can do because he knows he has limitations. I think at 11, he's more accepting of those limitations, but at like 8 and 9, it was a lot of tears, a lot of days. And it was very heartbreaking as a mom to watch that wow. Kids are going to go do what they want to do, and your child is left out with this invisible disorder. He doesn't have crutches or a wheelchair or anything to show he's different. So I think that was hard. That was a lot of tears as mom watching him get left behind. And I will say, George has figured it out. Yeah. He's found the things he can do, but those kids really did at that age didn't care. And so, and that's typical kid development, but it was heart-wrenching as a parent to watch that.
Mm-hmm.
Yeah.
My goodness.
That's so it's affected
we
your
all
whole family.
Lots of therapy after all the healing process, I think from a financial standpoint. I mean, a lot of the things we paid for were private. And so I had to take off a lot of work. When you're seeing 20 doctors, you know, we would have 3 and 4 appointments a week. And so I think from that standpoint financially, and I think we have a whole nother child who really would say, if he were sitting here beside me, he got left in the wind a little bit during all of this. So there's been just a lot of repair. We're at a good space now, and it kind of feels weird. We have like 1 doctor appointment every couple months now, which is very different. I mean, we were going up to 3 to 5 appointments a week for a long time. Really hard.
What an incredible journey you've been on, Andy, you and your family and George, all of you. I almost hear you, and it's like this, there's got to be a book that comes out of this someday, because it's just the layers and layers of
that nobody can understand,
and triumph,
again, they can't
both.
see it. And like I said, if you've never experienced like any kind of vestibular issues, and I know Kimberly, you can say this now, experiencing them, it's so hard to function, and how hard it is to put one foot in front of another every day. And nobody feels proud of that because they can't see what you're going through.
No, and as most vestibular patients will say, we just isolate. When we don't have answers and we don't have resources, the most logical thing to do is just to remove yourself from the world. And for an adult or a child, that is just such a hard thing.
Dr. Christie, I know you can't, like we said before, we wish that Andy and her family had found you earlier, and you can't go back and change all the challenges that they had to go through, but can you give us a ray of hope about research that is being done now that will improve vestibular care for children?
Yes, absolutely. So I think there is a lot more awareness now of this, through organizations like VITA. There are international groups who are, getting into this research. There was a meta-analysis systematic review that was published on pediatric vestibular disorders. And so I do think that people are becoming more aware of it. I think that in PT and OT programs, it's being taught at a deeper level now, whereas, previously students would get 1 lecture on it, and now it's like, okay, this is something that you really need to learn. And there are continuing education courses on it. I do a competency based course here at UAB every other year. So we're trying to train people, and people come from all over the world. Another thing that we're doing is actually we just met with people who are leaders in this area all over the world, and we're starting an international pediatric, we're calling it a Balanced Society, but it's to focus on pediatric disorders and how can we raise awareness and how can we, really spread this worldwide. So so there's that. And the research, there are more studies coming out on, the efficacy of this. The thing about doing clinical trials on vestibular rehab is every patient is so different, right? So if you're going to do like a very clean randomized controlled trial, your treatment group, they all kind of have to look alike in the treatment group. Otherwise, you could say, oh no, this person didn't improve because of this person, improved because of that. So it is extremely challenging to do like a randomized control trial with a certain group of patients. But as I said, there's a group at Ghent in the Netherlands who they are working on like a randomized control trial on this right now. And I'm kind of helping them with that. So people are really interested in showing the efficacy of this. The study that I'm doing it's really a feasibility study to see, if we do this with a group of children, there's not necessarily a control group. We're really just seeing, can parents do it? What does the intervention look like? What are the effect sizes of the outcomes? So, and that's going to inform future trials, hopefully, in this area. So, like I said, there's your central issues, and then within your central issues, there's lots of different categories, and then there's your peripheral issues. It's the same thing with adults. It's tough to do an RCT on an intervention, but we are doing our best, and there are people working on that right now. So there is, I think, hope, and I appreciate what Vita does, to kind of spread the word and to just to support people. I send people to y'all's website all the time.
Well, hopefully some of those parents are listening today even, and I want to know. They probably are going to want to just reach out to you, Andy.
I think it was Cynthia sent me a mom or two just to not feel so alone in this. So I'm always more than willing to talk about it.
Yeah. What would you, if you had something to say to them today, words of wisdom, at whatever stage they're at with their child and the diagnosis and all of the treatment, what would you want them to know today?
One is follow your gut. I mean, if I could look back from a young, from George at 18 months old, and following your gut, like when you know something's wrong with your child, maybe you're not with the right provider that may say it's all in your head. I think we all hear this as vestibular patients, it's all in your head, it's all anxiety. Following your gut that you know something's wrong, and there's another provider out there. I mean, I have fired plenty along the way when I knew it wasn't a good match for us. I think knowing this process, I had a mom tell me this along the way, that it's not linear. Like there is a step forward, 10 steps backwards, 10 steps forwards, a step backwards. It's not linear. And I needed somebody to say that to me, that there isn't a miracle answer like that you can give a pill or anything, but through hard work and dedication, there is hope at the end of this. I mean, there truly is. Now, I did an interview 2 years ago, and I don't know if I believe that, but I truly say there is hope and there's healing at the end of this. And I think the third thing is these kids are so resilient. Your child will be okay. I used to hate being told that too, that George is this beautiful, brave, resilient, determined, and a compassionate child because of what he's been through. He sees life very differently, and that hope is there in all of it. I mean, it has made him into who he is. It was not fun along the walk, but I mean, he is an incredible kid because of it.
And that's such an important message because like you said, 2 years ago, you wouldn't have believed that. And those stages are also so very real, but I think we all hold on to the stories, your story, George's story, when we know you've been there.
Just
and then
you take a big deep breath.
The other side.
You made it to the other end.
Me too.
Thank you.
Both you and George are so inspirational. Andy, thank you so much.
Thank you so much for having us. And I think it's just so important. There just needs to be so much more knowledge about this, and for providers to know how hard it is from us parents' standpoint when it's minimized or in our head, or they're just saying, like, it is just, it's so hard from a parent standpoint. You're just devastated and you don't know what to do. We just need somebody. I always kept saying, can someone please steer the ship? I need a captain to steer the ship, and we just need somebody to steer the ship for us as parents.
Yeah. Yeah. Dr. Christie, what would you say to a parent who found out that their child is struggling with vestibular symptoms?
Yeah, I would echo, Andy's beautiful statements, but also just to know that the brain is limitless. Like, really, it is limitless in what it can do, and it's gonna take practice and hard work. But the brain can change. It takes doing it, in a systematic way, and but again, just to have that hope that they can get better. They can do whatever they want to do. It just might take a little bit more time and work. And it's tough, when people live in rural areas. But I would also want to speak to the adult vestibular therapists out there that you can work with children. The science, how to do the exercises. You just have to make them fun. And kids actually work a lot harder than adults, in my opinion. On these things, they don't complain as much. I don't think. I mean, I get along better with 4-year-olds than I do adults, but you just have to make it fun. And so I'm happy to share. I have this whole library of children's books that you just open up the PowerPoint and the parent can turn the head while the kid reads the book or whatever. I'm happy to share that with anybody. We have a Facebook group that it's not super, super active, but it's called Pediatric Vestibular Therapists. And, if people want to join that, clinicians will kind of talk about different cases and things like that, that as well. So
that's great. That I also want to just say to anybody out there, any therapist out there who does treat children, please let Vita know. The key to helping these kids is to get them connected with the right healthcare providers. And Vita has a directory of vestibular healthcare providers on our website, but it's only as good as the people who participate in it. If we don't know who you are, we can't get you on there. So please let us know who you are so that we can help get parents and kids connected with specialists like you. So thank you both so much for sharing your expertise and your experience. This has been such a learning experience and so touching for me, and I'm sure for everyone who's listening.
Thank you so much.
Thanks for tuning in to ICU this month.
We hope this conversation sparked new understanding of the vestibular journey. And for all of our patients out there, leaves you feeling just a little more heard and a little more seen. I see you.